Hello students, this lesson is on how to read a trauma X-ray. In the last lesson, you were taught the basics of reading any orthopedic X-ray. You were taught the systematic ABCs approach and a series of questions that we use to communicate the X-ray findings to our colleagues. So this lesson, we're going to concentrate on trauma X-rays and how to describe fractures, subluxations, and dislocations. In the video clip that you're about to look at, you will learn about the terminology that we use to describe fractures. You will learn about the fracture patterns and how to describe the alignment of fragments in relationship to each other.
Fracture pattern describes the type of fracture line. The different fracture patterns include transverse fracture, when the fracture line is almost perpendicular to the long axis of the bone. Oblique fracture, when the fracture line makes an acute angle with the long axis of the bone. Spiral fracture, the fracture line runs spirally in more than one plane. Comminuted fracture, this is a fracture with multiple fragments. Segmental fracture, in this type, there are two fractures in one bone, but at different levels. Impacted fracture, a fracture in which the end of the bone is driven into the contiguous metaphyseal region without displacement. Depressed fracture, a form of an impacted fracture that involves the articular surface of the bone and results in joint incongruity. Avulsion fracture, a fracture in which tendon or ligament is pulled away from the bone, carrying a bone fragment with it. Alignment is the relationship in the longitudinal axis of one bone to another. Fracture and dislocations may affect the normal alignment on the radiograph. Fracture angulation is the degrees of angulation of the distal fragment in relation to the proximal fragment. The distal fragment can be in varus or valgus angulation, and also in flexion or extension and rotation. Apposition is the amount of end-to-end contact of the fracture fragments. Bayonet apposition means overlap of fracture fragments in the longitudinal axis. Distraction is the displacement in the longitudinal axis of the bones. The fracture can also be medially or laterally displaced, depending on the position of the distal fragment. Subluxation or dislocation of the joint is present if there is disruption of normal relationship of articular surfaces. One must also note the direction of the dislocation.
So now we have learned a system to describe any orthopedic X-ray and now specifically trauma X-rays. So don't forget the ABCs and the series of questions. And now we have two more questions to add. What pattern of fracture, and is there any malalignment of the fragments with relationship to each other? So that's it. Now, in the next part of this lesson, you're going to be allowed a chance to practice these newfound skills. And we're going to look at some X-rays, and you're going to try describing them.